Welcome, everyone. It's 4 o'clock. I'm going to ask Lisa to do the roll call, please. I'm calling the meeting to order. There are 5 of the 6 Board of Health members. Lisa, I understand that Julie Mullica is not joining us tonight. Is that correct?
Yes.
Okay, well then it looks like we're all here. So if you could start the roll call, please.
All right. Please state present after your name is called. Representing Adams County on the Board of Health, Rosanna Reyes.
Present.
Julie Shills.
Present.
Okay, and Julie Mullica is absent. Representing Arapahoe County on the Board of Health, Jan Brainerd.
Jan's muted, but looks like she's here.
Yeah, okay, I see her.
No,
Yeah.
I said present with it unmuted. I guess she didn't hear me.
That's okay. Okay. Dr. Thomas Faywell.
Present.
Dr. Kaya Gallagher.
Present.
Tri-County Health Department Leadership, Michelle Askenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance.
Present.
Heather Baumgartner, Director of Community Health Promotion.
Present.
I'm Lisa Bolstad, Administrative Assistant. Jill Bonsinski, Director of Nutrition.
Present.
Dr. John Douglas, Executive Director.
Present.
Maine Furman, Director of Human Resources. Melissa Spencer, Director of Nursing.
Present.
Brian Halavasek, Director of Environmental Health.
Present.
Jennifer Ludwig, Deputy Director.
Present.
Brianna Paderewski, Director of Administration and Finance.
Present.
Roll call is now complete.
Great, thank you. Did the Tri-County team want to introduce anyone who's attending our meeting tonight?
I would like to. I'd like to introduce Sue Hauk. She's with our Community Health Promotion Division, Greta Allen with Nursing, and Caitlin Matthews with Environmental Health. They'll be presenting with me later tonight on the Health and Food FIP update.
Great, thank you. Anybody else? Not seeing any hands raised. Lisa, I guess you could see that Maine joined us.
Yes, hi, Maine.
Great. As a first action item on our agenda, do I have a motion to approve the minutes from August 11th?
So moved.
So moved.
Great. Is there a second?
Second.
Okay, any discussion?
Well, they could reprint my name correctly.
Oops.
Oops, just an extra L, but usually people put in an R, an E, a few other
sorry.
consonants, and yeah, it's all right. No
That's
problem.
all right.
Just
I can
point it
tell
out.
you.
Just
I
keep
can
everything
totally-
correct.
I can totally relate. I can't tell you how many different ways my name has been spelled.
Yeah, how about Jill?
Okay, any other comments, questions? Not seeing any. All in favor, please say aye.
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 Anyone opposed? Okay, the motion carries. Thank you. The next item on the agenda is approval of the quarterly financial report. Brianna, did you want to give us some background on this document?
Hi, thank you. I was just going to give you a quick high level. So through June, we have revenues totaling 31.3 million. We are under budget by 2.6 million. For expenses, we have a total of 28.9 million, under budget by 5 million. This puts us with a net income of 2.4 million. Are there any questions?
There was a lot of detail in that material. Thank you, Brianna, for pulling that together. I'm sure it's a complicated and challenging job. Not seeing any. Oh, Jan, you're muted.
I just had a question. I was just curious, under 374 and 492, what does hashtag 0 exclamation point mean? I was just curious what that was.
That would be a formula error, and I did not see any.
I mean, sometimes I write that as a swear word, but you know.
That is not what I meant.
I just thought maybe it was secret code or something, and I was just curious.
Oh, that's only because I apologize.
No worries.
That is because there's nothing for it to be taken over. So it's essentially, there's no budget in that line. And so it's over 0, which is not,
Well, I
doesn't
like,
give us anything. So
I like that better. Thank you.
apologize.
Dr. Faywell?
Just a quick question. Are all of the Tri-County financial statements open to the public? Are they public records going way back?
I believe so. I would have to find where they are available, but yes, they're public record.
Thank you.
Okay.
Dr. Faywell, do you mean the ones reported at our meeting, or do you mean the annual audit, or both?
Both.
Certainly the annual audit, and I think the Board of Health packet is public, so I think the answer would be yes to both.
Okay. Not seeing any more hands raised. Is there a motion to approve the quarterly financial report?
So moved.
Second.
Thank you. Any further discussion? If not, all in favor, please say aye.
Aye.
Aye. Anybody opposed? Motion carries. The final action item on tonight's agenda is a consideration of the Board of Health meeting schedule for the remainder of 2022. So, John, did you have some remarks to make regarding this topic?
Yeah, let me say that can you guys see my screen?
Yes.
There was a discussion at the, I believe, July meeting when I wasn't there about whether the monthly meeting roster made the most sense for the rest of the year. I think we discussed this briefly at the August meeting, given the ambiguity about receivership, which of course you all know has now been approved by the court. We decided to keep meeting monthly. Kaya, Julie, and I had a brief email exchange about, for the remaining quarter, really, the October, December, or November, December timeframe, would it make sense to meet monthly? And certainly Tri-County staff is prepared to do whatever the board thinks might be the most effective. But Kaya and I did talk about a schedule that might look something like what I've got on the screen. And again, is this big enough for everybody?
Yes.
Yeah, okay, fine. And the idea was potentially taking a hold on the October meeting, having an executive session on legal matters if needed, as we'll be doing tonight, that then potentially meeting the last 2 months of the year and considering even, and again, this is underscore possible considerations, not a done deal from Tri-County or from me to you guys, potentially considering an in-person meeting, which we've not been able to do for quite a while, and that we might even revisit our typically end of the year holiday tradition of having a dinner, and a possible agenda, including a wrap up on our various FIP related activities that Callie Preheim has been working on. Callie, you'll remember, gave us really nice updates on our community health assessment. Probably the last of the year COVID and flu update from me, an update from the receiver, as well as, again, if needed, an executive session for a legal update. We talked about, by the way, if we did an in-person dinner meeting of some kind, it might be better to do it in November rather than the traditional December, simply because December will be, I think, increasingly complicated with various wrap-up matters, and doing something that's a little bit more out of the ordinary, like having an in-person meeting, might be a little more challenging in December than it might be in November. And then finally, in December, the very last month of our existence, an idea would be to repeat the updates from our new health department leaders, Kelly and Jennifer. Again, have an update from the receiver. item C on here is a vote on dissolution of Tri-County needed, and preliminary indication is that don't really need such a vote, although some acknowledgement of it might be an appropriate symbolic statement by the board. And then finally, if we need an executive session, to have that. So I'm just outlining this not as a, here's the new schedule, but rather just a draft for folks to react to. And Kaya, please amplify or anything I didn't say clearly.
Yeah, well, thank you. This is clearly just a draft. So as always, if there are some other topics Board of Health members would like to see addressed, you should let me or Julie know. The other point I'd like to make is thank you, Dr. Douglas, for sending out the emails about the updates on the legal situation. And I assume you'll continue to do that even if we don't have an October meeting, and we may end up having an executive session, but that you'll keep the Board of Health informed about any of the important issues we need to know. Is that not correct?
Absolutely. And that would include information from the receiver, who I'm pretty sure Belen is on with us tonight and wants to be available to share any wrinkles that come up as she's carrying out her new responsibility.
Great, thank you. Are there any comments, questions?
Hey, can we take some time to think about that in-person dinner meeting? We're not voting on that today, right?
No, certainly from my perspective, but I'm just the guy who put this together. This is a board decision, Rosanna.
Yeah. My concern after there's always down in Greenwood Village, and we are met with the challenge of commuting, oftentimes in weather. So that's my thought.
Okay, good
Thank
point.
Mhm.
Jan?
Yeah, I just have one comment. I'll bring the tissues in November and December. The other thing is this was more about a subject. What happens to the FIP at the end of the year? Does that just completely go away and all the other health departments will be doing their own?
Yeah, that's correct. I mean, we'd like to transfer, Jan, as much summary. What have we accomplished? What was our structure? If you're interested in the topics we addressed, mental health, food, healthcare access, and housing, here was the way we did it. If there can be momentum in carrying it forward, that's great. But it is really the end of our efforts at the Public Health Improvement Plan.
Okay, thanks.
Okay, not seeing any more comments. Dr. Douglas, I think all we really need to do is to vote on canceling our October meeting and then scheduling our November and December meeting. In other words, we're not voting on the content of the meetings. We're just making the agreement that we're not going to meet in October in an official board meeting. That is, unless we need to. Is that correct?
Well, that's my thought. Once again, this is a board action, and the content was just put up there as an illustrative example of what ground we might cover. But as I really appreciate Kaya noting that certainly other items that emerge of an emerging nature or that a board member has an interest in, we can certainly include things beyond what I just listed.
Okay. Any more questions, comments? Not seeing any hands raised. So do I have a motion to, I guess, just to cancel the October board meeting? Is that correct?
I think that's really what we're talking about. Yeah.
Okay. Do I have a motion to cancel the October board meeting?
So moved.
Is there a second?
Second.
Second.
Thank you. Any further discussion? Okay, all in
Well,
favor? Oops.
Oh, no, sorry. I'm after the vote. I apologize.
Okay, no worries. All in favor, please say aye.
Aye.
Aye. Anyone opposed? Motion carries. Just recognize again that this is a very flexible set of topics. If there are things that you're really interested in or you want more information on, please let me know or Julie know. And we will make sure that the Board of Health members are kept informed, even if we choose, as we've chosen not to meet in October. Dr. Douglas, did you have a comment? Okay. Did you have a comment? I'm wondering if he's having internet problems.
Yeah, earlier today it was, so he may come in and out.
Okay,
I've
well,
seen. Were you calling him, Micaiah?
yes, I was, because I thought you were about to say something earlier. Okay,
I did. I got unstable internet again. I'm sorry. I just want.
well, we're just going to have to save that good thought. Because we're not hearing anything from you right now. So why don't we then move on to the information items on our agenda. Welcome, Jennifer and Kelly, who are here to give us an update. I know both of you are really busy, so we really appreciate you taking the time to let us know how things are going in Adams and Arapahoe County. So I'll leave it up to you to decide who goes first.
Kelly, if you want to, that way you can get going if you need to. So you take over and I'll follow you.
Sure, no problem at all. Right. Am I able to share my screen? I haven't tried, but I have that power. Right. Just a second. All right. Can you all see PowerPoint slides? Yes. Okay, great. Well, good evening, everyone. Kelly Weidenbach here with Adams County Health Department. I'm here to give an update on our transition process. And just want to thank the Tri-County Board and leadership for having me today. I think we're all very committed to assuring continuity of services and assuring a smooth transition as much as possible through the next upcoming months. So just a quick overview of our agenda today. I'm going to do just some introductions, not introducing everybody verbally, or not everyone is here, but I'll give you guys an overview of the leadership team that we have in place right now, some overview of our timeline for the transition, a little background on our planning process, the new Adams County Board of Health, our organizational structure, kind of hit upon how those core public health services will be met in Adams County, some updates on staffing, our locations, and programs and services, and some information about budget and how it might compare to similarly sized health departments and partnerships. So I will just keep moving. So we have five members of our leadership team hired and in place over here at Adams County. So I've been named as the executive director. We have Dr. Darcy Martinez, who is our public health and nursing division director, Adam Anderson in epidemiology and data science, Brian Plavasek in environmental health. And recently we promoted Monica Bulig into our health equity and strategic initiatives position. We also have Doug Glenn as our informatics project manager, and Melissa Sager is our assistant county attorney for health. We have a total of 10 staff right at this moment, but these are kind of the folks helping to lead the transition process. We are still in process of hiring and posting our medical officer position, the deputy director, and we're completing interviews for the nutrition and family health division director position as well. So those are the three remaining leadership positions we will have be announcing. And I'll mention that our medical officer position will be a staff position. It will not be contracted. So just a little overview of timeline just for this year. You know, back in Q1 of 2022, I was hired as the transition director. We formulated an internal steering committee, which I'll speak to in just in a minute, more detail. And that's when we began study sessions with our county commissioners regarding core public health services, what's mandated in statute. We gave an overview of our CHA and the foundational capabilities and services. Moving into Q2, we continued those study sessions and really started getting into more granular detail around programs and services and those funding sources to give the BOCC an idea of how programs and services are provided, what type of clientele they have. We provided some performance metrics, and then getting them to understand what funds each of those programs. We started leadership team recruitment in Q2. We developed our organizational structure and staffing plan, and then also in late Q2 began recruitment for all staff positions, and probably similarly to Arapahoe County, doing a lot of grant applications in Q2 and Q3. So in Q3, our Board of Health was formed. The executive director was appointed last week. Our staff recruitment continues. We've really ramped up community engagement, and our focus in this quarter and the Q4 will be really focusing on those operations, policies, procedures. We're getting a lot of funding notifications, and also we'll be looking at local regulation adoption here in Q3. Q4 will be moving into the execution, the full execution of our implementation plan, looking at staff onboarding and training, and ongoing community engagement. And here soon, the BOCC will be adopting our fiscal year 23 budget for the county as a whole, which our health department budget will be part of that. And obviously January 1st, our go live as a health department, and we'll be planning a lot of ongoing monitoring and evaluation. And then that's where the CHIP and strategic planning will occur, and we'll be developing processes for those mandated deliverables. So just a little bit more about our planning process. We are using formal project management, which is a role that I hired Doug Lennon to help with, and he is trained in formal project management. We have this internal steering committee, so this is really looking at the county supports for the transition, and you can see the list of the different groups and departments within the county government that have been assisting and sitting on the steering committee, and it's pretty comprehensive. We've been looking at both, resources that are needed to help support the transition, but also looking at integration of the health department within the county government. As I mentioned, our Board of Health was formed and appointed on August 16th, and this is the inaugural board. This is a transitional board, so I think we all understand this board does not really take effect in terms of statutory authority until January 1. We received 21 applications, 10 candidates were interviewed, and these 5 were appointed. Notably, no commissioners were selected, and no other elected officials were selected to be on our Board of Health. And we are meeting regularly the 3rd Thursday of the month at 5:30 p.m. and also have some special meetings between now and the end of the year just for specific operational items. So let's see. So this table just gives you an overview of some of those public health foundational capabilities in the Colorado rule, and just kind of where the health department is taking the lead role or a shared role, or where another county health department, county department within the county government is in more of the lead role. So obvious places are human resources. We would not replicate that capacity within the health department because that lives within the county government already. Same thing with legal services and finance, contract procurement, ITI. So you could kind of just see where the health department will be kind of the lead. Policy development and support is a good example where that lives in both places, but we're really speaking to public health policy here and where we'll be the lead. And we have been engaged in that area already. Let's see. Organizational structure. This is a very high level structure. There are some things missing that I still need to add, but it gives you a sense of, how the organizational structure shakes out. We have 5 divisions and then 2 sort of smaller offices, the Office of Administration and Accreditation, where vital records will live, our accreditation program, and some of the pieces that are in that purple color coded area really are where the rest of the county government interfaces with the health department. So that's where our budget and finance team would interface with the health department. our PNC team, which is People and Culture, our HR team. And then you also see the Office of Public Health Emergency Preparedness and Response. But other than that, very similar divisions to Tri-County. I would say one notable difference is the Health Equity and Strategic Initiatives Division, which really is where that emphasis on social determinants of health and health equity lives. And that health equity and community engagement program and community health promotion programs, both are large programs that encompass a number of things. Health equity and community engagement really encompasses sort of PIP type focused work around social determinants of health, access to care, food security, food systems, regional health connector, and then the community health promotion program includes mental and behavioral health, tobacco control, substance abuse, and overdose prevention, maternal and child health systems work. So really kind of bridging, I would say that division really is sort of our public health 3.0 chief health strategist, policy systems change kind of division. And the epidemiology and data science, similar, but slightly different to the planning and information management, different in that communicable disease epidemiology is included in that division. And we're still exploring some competitive grants for diabetes education, for example. So we'll be working on adding that if we find out from the state that we are eligible for that funding. So yeah, I will keep moving on. So programs and services, this is high level, obviously does not include everything that we will have or that Tri-County currently has, but just kind of giving an overview of the things that we're focused on and why they're in the org structure. This is more for non-public health folks. And just an update on staffing. So for fiscal year 22, our Board of Commissioners have approved 28 FTE. And we have hired, actually that number has bumped up to 12 as of today. So we have hired 10 are on board already, 2 are coming on board just in the next couple of weeks. And then for fiscal year 23, we have sort of what we were calling our baseline FTE headcount. That's been approved by the Board of Commissioners. That's 170.75. And we have filled or people have accepted 130 of those, or 76% of our staff positions to date. So far, 120 Tri-County staff have accepted job offers with us, which are our transferred positions with those start dates of January 1. So the idea with that was that we wanted to keep those Tri-County staff in place until the end of the year and facilitate a process sort of matching with legal criteria for the same role, same function to move over at the first of the year. And so we have 120 staff who have accepted those offers. And then the remainder of our positions will be recruited through open competitive process. And we have a strong focus on DEI here at Adams County. So that'll be something that's embedded and woven into everything we do, including our staff recruitment. Budget and funding. So we have estimated approximately 25 million in operating expenses for fiscal year 23. We believe approximately 19 million will be in personnel costs. And we are anticipating another 5 to 6 million in other expenses such as supplies and equipment. Diverse revenue funding, just like Tri-County, a lot of grants and contracts, fee for service. There's both competitive and non-competitive grant funds. The county general fund contribution will be substantially more than what has been historically provided to Tri-County Health Department. And you're seeing a greater investment in local public health needs. And we're also losing that economies of scale that was offered by the Tri-County arrangement. Budget is comparable to similarly sized jurisdictions with single county health departments. And I have a slide on that in a moment. And we've been really messaging with our stakeholders and the BSCC around our inaugural years that the health department may require more county general fund as a proportion of the total budget than in later years. And we are just hoping that as time goes on and we become established that we will be more competitive for grant funding in the way that Tri-County has been established and competitive for grant funding. So here's a great slide deck that I had shown my commissioners just to help them understand kind of where other health departments of similar size are at with total FTE and headcount. These are not this, most of these counts do not include COVID staff. These are kind of their baseline headcounts and then their health department budget. And if I could find their county general fund contribution, I have listed that there. So it gives everyone a sense of, we're right in line with where we should be with a population size of what we have. And just last slide on partnerships and community engagement. We're working with a lot of different stakeholders, our state partners, municipal governments, school districts, all the usual organizations that health departments work with, and doing a lot of meetings and being out in the community. I was just at Federal Heights City Council earlier this week. So yeah, there's a lot going on, and I will just pause and allow for any questions.
Thank you, Kelly. I know you've got a busy schedule tonight, and so rather than going to Jennifer, we'll just entertain questions for you right now. But congratulations on how much progress has been made. It's actually pretty phenomenal, knowing how much work went into just creating this new health department. So it's very impressive. You should be very proud.
Thank you,
Dr. Faywell.
Certainly is impressive. But one thing in the, Kelly, in the staffing criteria, it's based on DEI. I would hope for the sake of the citizens of Adams County that we include a C at the end of that, not only DEI, but competency. It's nice to have diversity, equity, and inclusion, but let's have people, and it seems like you've already done that, hired who actually know what they're doing.
Absolutely. And well, that's why we prioritized Tri-County staff who are already in this community working, and that was part of our staff transfer criteria, was the highly qualified staff that are already at Tri-County.
Thank you. Rosanna?
Tom, I'm taken aback by your comment that you would think it'd be necessary to add competency to the DEI, which is a business standard across the nation now. So I'm a little taken aback by your comment.
Just because it's a standard doesn't mean it's complete.
Well, neither does adding competency when this is a clearly very evidence-based practice, that you would feel it necessary to add competency to a diversity platform.
Okay, point well taken. I guess I have a question for you, Kelly. Did I hear you say accreditation? Are you anticipating it sometime in the future to pursue getting your health department accredited?
Absolutely. You may know this from my time at Tri-County. I am a FAB site visitor, and I believe in the accreditation process. I don't quite know, I haven't had time to really think about a timeline for that yet. But I think we're building policies, procedures with that in mind, and hopefully, meeting all of those standards and measures under those domains so that we are assuring a high quality health department.
Great, thank you. And Julie, I know you're in the Austin airport, but if you have any questions, you can put them in the chat. And thank you, by the way, for tuning in. Are there any other questions, comments? I see that Dr. Douglas said very impressive work. We wish you all the best. So thank you again for taking the time for this very, very thorough presentation. Not seeing any more questions or comments. Dr. Douglas.
Well, I just wanted to say I'm really glad to see the roster so replete with some of Tri-County's best and brightest, Kelly's. Nice job in recruiting them, and I'm glad to see they're going to be helping you do stand up a fantastic health department.
Thank you. I agree.
Thank you. And now we'll we'll let you go to your next meeting unless you want to stay to hear Jennifer's presentation.
Thank you. Thank you so much for having me. I appreciate it.
Oh, Jennifer, you're on.
Great. And thank you. Thank you, Kelly. I think, let's see. Let me get- Hopefully, I think this is a good sign or a good thing that you'll probably notice a lot of similarities between the planning and the progress between the two health departments and the formation of. So I think that's good. And I think we went in with similar missions of what we are looking to build. So a lot of this is very similar to Adams County, which is, I think, puts us in a good place in working together. And of course, Kelly and I work very well together and have been talking regularly. So timeline with Arapahoe County. As you are probably aware, the Arapahoe County team, this was a little bit different direction. They did not hire a transition director. They worked as a team of Arapahoe County leadership. So the directors of finance, HR, IT, human services, and then of the commissioner's office met regularly, retained Ottawa as their consulting group to look at and consider what was needed as a single county health department. They did community engagement through surveys and seeking feedback from businesses and residents. So a lot of work in the first quarter of the year. They brought in subject matter experts from Tri-County to help provide education on and information of services and that Tri-County does, as well as the big picture of what public health does, to really help them understand what is this thing that we're building and what does it need to look like. I worked closely with them in providing recommendations for structure, for what they would need. Callie did a great presentation for everyone on the community health assessment to help them understand the needs of their community. So then in June, the county commissioners, and I'll acknowledge Commissioner Jackson, who's our Tri-County Health Department Board of Health Liaison, also is serving on the founding Board of Health for Arapahoe County and is with us tonight. So Commissioner Jackson, thanks for joining us tonight. It's a 5-member board, same as Adams County. They are a foundational board. They do not have public health authority to make public health decisions because Tri-County retains that authority until the end of the year, but they are establishing the policies, procedures, regulations, rules, budgets, everything that are needed in order for us to be ready to open our doors in January. They were appointed on June 14th. Our board does have 2 commissioners. We've got Commissioner Sharp, who serves as the chair, and Commissioner Jackson. And the 3 other members are Dr. Signorelli, Sean Davis, and BB Kleinman. And they have been meeting twice a month since June, and we'll meet twice in September. We may go to monthly after that. And then that will probably be the regular cadence moving forward. In June, they appointed me as their public health director. And at that point, we started hiring our staff. And so we are now in the 3rd quarter and moving close soon into the 4th quarter of continuing our implementation of planning. So here is what our structure, and this is very high level also, move this out of my way. This is what the big picture of the department looks like. We have first, we've got our Board of County Commissioners, our Board of Health, and then the Public Health Director. We will be having our Chief Medical Officer will be a contract as opposed to employee, so a little bit different than the Adams County model. This a box of additional county staff. So similar to what Kelly was explaining, there's a lot of things that we don't need to replicate in this new single model or single county health department. That includes IT, HR, communications, legal, finance, and facilities. The county already has these functions, and they have increased their capacity in order to assist and support public health. And so we will have business partners assigned to us and working with us. And like in communications, we'll have almost an entire person just working with us in working with their team. So it's a little bit of a different model. We have our executive assistant and the Board of Health liaison who has been hired, Abby Schmidt. She started a couple of weeks ago. And then our divisions, we have environmental health, communicable disease, and emergency preparedness and response as a single division with 3 different programs there underneath. Michelle Askenazi will be serving as that director. In environmental health, Laura DeGallier, who many of you probably know very well, she's been with Tri-County for 20 plus years. She will be our associate director of environmental health. Sarah Garrington will be the emergency preparedness and response manager, and then Melissa Adair will be our communicable disease manager. In admin and operations, this division will be just that. They'll be doing and I'll go into this a little bit more in the next slides, but Brianna Paderewski will be serving as our director of admin and operations. Then moving over to the right, partnerships, planning, and strategy is Heather Baumgardner will be serving as the director in that role. And there's this dotted line to community health promotion, and I'll explain what that is, but keep that in mind as I get to the next slide. We are providing room for growth. We wanted to make sure that we left this as a placeholder and as to not have to fight for it later. And then our deputy director, Penny Grandy, as you know, has already moved over to Arapahoe County, and she will be overseeing all of what is being termed the community health programs. So nursing, nutrition, and then eventually community health promotion as we grow into this. So for Arapahoe County, currently there are 95 employees of Tri-County who have accepted offers for Arapahoe County. There are approximately 30 offer letters that are set to go out this week. And then we have several other positions that are currently open. So I do anticipate that my goal was to get to 130 by January. We will be over that goal before we get to January. So I'm excited how many of Tri-County, similar to Adams County, it's great that we are able to take the expertise and provide jobs for many of Tri-County's employees. So this comes from a combination of the OttaWe report from last year. You may recall Adams and Arapahoe jointly hired OttaWe to do the phase 1 assessment. And they estimated that the Arapahoe County would need 170 to 200 FTE for its health department. We are budgeted right now at 182.7. So we are that's probably not enough. We'll probably need to add some FTE. But right now, I think we need to get going and see where we are and see how the funding comes in. And then we will start to increase. We had presented, this was months ago, to the Board of Health. We had completed a survey. Tri-County Health Department had done a survey of our staff asking them to pick their employer of choice. And we forced them into boxes, but it was a way for us to be able to provide that pathway of employment. And at that time, this was that point in time, we had 133 employees, Tri-County employees, who said they were interested in going to Arapahoe County. So I'm really pleased that we will probably surpass that 133 number in our ability to hire Tri-County employees. So our programs and services that we will be offering, and this is not entirely completely inclusive, it's a pretty solid list of what it will look like when we open our doors in January. So in environmental health, emergency preparedness, and communicable disease, all of our environmental health programs, I can't say all of them. Not all Tri-County Health Department environmental health will immediately go over to Arapahoe County, but the majority will. And we will have to build up our capacity over time. We'll have a robust emergency preparedness and response program, as well as a COVID response team. And then, of course, our disease investigation and control. And then in admin and operations, this is where vital records will live. Brianna will have a team working on the grants management, because as you know, how many grants we receive that have to be invoiced, do invoicing, billing, budgets, and they'll be the liaison to the business partners. And then partnerships, planning, and strategy. This is Heather's team. This is where the public health improvement plan and community health assessment will live. We are getting ready to hire or post for population health epidemiologist. Currently, this is where tobacco will live, but eventually it will move once we build out our community health division. And then community engagement will be another position we'll be posting soon. And again, that placeholder for community health promotion, tobacco, substance use, mental health, healthy aging. These are all funding applications and sources that we are looking at and hoping to obtain soon so that we can build out these programs. But these are placeholders and opportunities for growth. And then in nursing, we will have our nurse home visit programs, immunizations, sexual health, harm reduction, maternal child health, and of course, our child fatality prevention. There are probably other things that are in here that aren't listed, but these are our big programs that we intend to hopefully have seamless service. And then of course, in nutrition, WIC, breastfeeding, peer counselor, food security, and there's again, a lot of opportunities and areas for growth. So some of the assets and work planning that is underway, we are implementing an electronic health record. Arapahoe County has gone with CureMD. That is underway, and hopefully we'll be able to do some live testing October-ish. And same with the environmental health software, which is HealthSpace. Most of the state is on that, and we're in the process of getting that implemented. Have been evaluating all the computer needs, hardware needs, and working on how we make those transfers. And Arapahoe County will be taking over, or is currently negotiating the leases for the admin office, and the one in Greenwood Village on Willow, as well as our Aurora South, the Hampton Villa office. We will be closing the Aurora West office, which is a WIC clinic, and Jill has plans and has been working with the team on moving that team over to Aurora South and Aurora East, which the county calls Altura. And then we'll be keeping Altura and Inglewood. So we will have 4 locations in Arapahoe County. And our budget, the funding it's $21.2 million is our operating budget that we presented to the Board of Health a few weeks ago. They have adopted. It will change over time. It is a mix of the state and federal funds. It is anticipating grants and fees and Medicaid. It is based best guess on how Tri-County has been operating and what we know, and some unknowns. So do expect it to evolve. The AUDOE report had estimated 18 million. And at first, when we first started looking at our budget, we were at 18 million and had a $2 million gap from the revenue to the expenses. We've been able to close that gap with what we anticipate we will actually get. So we'll be, at this point, we believe we'll be operating a $21 million budget. Coming, so for the Board of Health, our next meeting is September 14th. The Board of Health will be reviewing the on-site wastewater treatment system regulations. So we'll have a team coming to present the regulations so that those can be put on public hearing and adopted in October, and would be live in December 24th. So they'll be looking at that next week. And then the following meeting, the last meeting of September, they'll be reviewing environmental health fees as well as body art regulation. And then in the last quarter, we'll be talking other policy adoption, program discussion, making sure that we're in alignment with priorities, setting goals, and setting ourselves up to start looking at public health improvement planning. On the staff side, we have hired a temporary project manager that I'm hoping to be able to make a permanent position. That person started a couple of weeks ago, hit the ground running, and is helping with all of these logistics that we're working on. But we are continuing to work on the budget. I just presented this morning to the Executive Budget Committee on what we anticipate. We will be seeking a chief medical officer in this last time of the year. And then in the last quarter, we're going to be testing our systems. We're going to be doing onboarding, transferring of equipment. So there's just a ton of logistics that are all going to probably happen toward the last quarter. And then in January 3rd is technically our first day in the office, and we go live. So that is where Arapahoe County is at this time.
Thank you, Jennifer. Jan, did you have a question?
No, just a couple comments. One is, I was just wondering what Jennifer's doing in her spare time these days. And the other thing I was going to just make a comment that, especially as a citizen and just a citizen in a couple months, Arapahoe County, and also for the Adams County folks, I am so happy to see how many people have been moved into the new health departments that are from Tri-County they were great leaders at Tri-County, and I'm sure that will continue for us as citizens. That's exciting. And also the expertise that they bring. So this really makes me happy, because when this first all started, I was really starting to not worry, but think about how are you ever going to do this? So I think you've got really great teams, both counties, and I wish you well. I wish you well.
Thank you. I think, Kelly and I talk as frequently as we can, and I know we both have our moments, but I think from my perspective and what I'm hearing and seeing in Adams, I think it's not going to be perfect, but I think both counties are in a good place.
Yeah, I just like to say, I think it's pretty phenomenal what you've created in such a short period of time. It's just amazing. And I guess I'm going to ask the hard question. December 31st is coming right up. Are you going to be, are you feeling confident that you'll have all the core public health services in place when we turn over the glove, if it were, to start, your health department?
Yes, I think, like I said, there will be some bumps. Right now, right before the Board of Health meeting, the Tri-County executive team met to really think about when do we stop doing things and when is that so that we can be ready to make that transition. There's a lot of coordination needs between Tri-County and the counties to make sure that systems are running, equipment is ready. I think the good thing is that both Adams and Arapahoe, for the most part, especially in Adams, there's no offices closing. We're taking over the same locations, a lot of the same staff. So people don't, we're not setting up brand new clinics for sexual health or for WIC. So it's same equipment, same people, same location. It's, the electronic health record may not be perfectly running. Staff won't be fully trained on it, but we'll be able to see clients as soon as, and they have a plan now to how to help schedule clients into next year. WIC has been, Jill's been working with her team on and working with the state on their WIC system, which is called Compass, to be able to make sure that we're scheduling. So I am confident that we will be running. I'm saying that it will not be perfect, but we will be operating, hopefully fully functioning come January 3rd.
Great, thank you. Jan, is your hand still up from before? You're good. So I'm just curious, what, if any, collaboration there is with Douglas County?
So Arapahoe County will be the provider for Nurse Family Partnership for Douglas County. I believe the Breastfeeding Peer Counselor program for Douglas County will be run through Arapahoe County. So we'll have an agreement with them. We have an agreement with them to do the Nurse Family Partnership Program. I still meet with Douglas County every other week to check in on how things are going. What do they need? We just recently transitioned environmental health over to Douglas County. I think it went really well. It was very well planned out. So we'll continue conversations with them. We've talked with them about future partnership opportunities in other program areas. Heather continues to try to plant seeds with them around things. Well, she and her team did a phenomenal job of planting seeds with maternal and child health programming, which they weren't going to apply. After talking with Heather and her team, they've applied. So we're still working our way with Douglas County. So there will be some formal agreements and probably informal collegial work that we do as public health professionals.
Great, thank you. Well, it's very, very impressive, both in Adams and Arapahoe County. So, and reassuring to see how much progress has been made and how close you are to having fully functioning health departments by January, which was actually pretty miraculous under the circumstances. Not seeing any other hands raised or comments. Both Jennifer and Kelly should look at all the congratulations and compliments in the chat if you have the time. Jill, it looks like you have several team members who will be providing the Board of Health with an update regarding the food and health objective within the Public Health Improvement Plan. Lots going on there. So
Yes.
It's up to you. Thank you.
All right. And just to piggyback on the note, I just met with Douglas County. Our Douglas County WIC team met with Douglas County today, and we have plans to meet moving forward too. So definitely some continued conversations and partnerships occurring there. So
Great, thank you.
Yeah, let me share my screen real quick. When you have a million windows open. All right. All right, can you guys see the screen okay?
Yes.
Perfect. All right. Again, thank you for having us tonight to give an update and overview of the health and food priority area. As I mentioned earlier, I have Greta Allen with me from Nursing Division and as a regional health connector, Sue Hauk with Community Health Promotions, a breastfeeding policy specialist, and then Caitlin Matthews from Environmental Health, and she is the food systems coordinator. So in our time together, we have, I think, 30 minutes. We'll give an overview of the health and food plan for year 3, and then really want to spend majority of the time giving highlights of the amazing work that each of the presenters have been working on with their teams for the Advancing Breastfeeding Colorado cross-program alignment and food and communities, and also next steps as we move out of this FIP area. And of course, I want to shout out to our health and food team. So Brian and I are the sponsors for the health and food FIP work. And then we have the small but mighty team that has continued to meet on a monthly basis to talk about progress, partnerships, and just updates on the works happening in the food arena. All right. So for year 3, we didn't change our overarching goals for goal. We had 2 goal areas, and I'll review those with you, but we did modify our objectives based on what was happening and also being forward thinking and thinking about capacity of our staff as we wrapped up work at Tri-County Health Department. But for goal 1, our overarching goal is to increase access to safe, nutritious, affordable, and culturally relevant food, especially in communities with limited resources and communities of color. So our first objective was to increase participation in federal and state food assistance programs such as WIC, SNAP, CACFP. I know this is a lot of public health alphabet soup, but we'll get into a little bit more of that with Greta's presentation on cross-program alignment. Second objective was to strengthen community-based food assistance, and you'll hear more about that from Caitlin with Food and Communities. And then for objective 3 is to create a seamless system of chest or breastfeeding support for parents and families, especially for those with less access to chest and breastfeeding resources. And Sue will be covering that with her review of the ABC grant as well. But another piece of that too is really looking at partnerships with medical health providers and our health systems just to coordinate any referrals and systems that might be needed, or training and education for staff as well. For goal 2, the overarching goal, sorry, I'm getting my papers all mixed up here. remain to promote food security and conditions that support healthy eating through messaging, education, advocacy, and policy development. So our first objective was strengthen local, state, and federal food assistance programs and food and agricultural systems through technical assistance, subject matter expertise, policy engagement, and policy advocacy. So those could be at different levels, as mentioned in the first part, but you got to hear from Heidi Fritz last month on the Healthy Beverage Partnership that talked about some of the local efforts. And Caitlin will also be touching on some of the efforts that she's doing through food and communities. Objective 2 is to increase public awareness and knowledge of local public health programming and opportunities related to food security through media platforms. And really this focus was on getting some of our programming and great efforts that we have across the agency and the divisions on our social media sites on Facebook, Instagram, and promoting those. And through the development, we also created a general nutrition landing page. Through the pandemic, we realized we had pages for all our programs, but a lot of people were looking for general nutrition education and information around their diets. So we created a landing page with reputable resources for people to be headed to or directed to through our social media platforms. So that was a really quick overview. Again, really want to spend the meat of our time on some of the amazing programs and projects that have been happening this past year. So I will be turning it over first to Sue Hauk to give an update on the advancing breastfeeding in Colorado. And Sue, just let me know when to advance.
Okay, sounds great. Thanks, Jill. So yes, Sue Hauk, I'm a community dietitian and breastfeeding policy specialist at Tri-County. Thank you for having me today. Really, the Advancing Breastfeeding in Colorado, or you'll also hear it called the ABC grant, is a regional initiative that seeks to reduce health disparities and improve overall health across the state by creating a seamless system of breastfeeding support for parents and families at their jobs, in childcare settings, and with their medical provider by certifying employers, childcares, and medical offices as breastfeeding friendly. So the ABC team includes Boulder County Public Health Institute at Denver Health, Jefferson County Public Health, Tri-County Health Department, and the Colorado Health Institute, which provides the evaluation and project management. The work on this project began in July of 2018 and will continue through June of 2023. You can go ahead and advance the slide, please, Jill. So as a team, we provide technical assistance to work sites, childcare's, medical offices to create a lactation policy if they don't already have one. This helps to ensure that they provide time and space for employees and clients who choose to breastfeed. So why have a written policy? It really helps with accountability. It ensures that all employees who need to express milk receive the same support, ensures the company follows federal regulations, avoids questions on roles and responsibilities, as well as provides a means to discuss expectations of not only supervisors and parents, but the other employees on staff. Then why is it important to provide the time? Regular removal of milk helps to keep one's milk supply up and avoids plugged ducts, mastitis, and loss in milk production. A flexible schedule allows the breastfeeding parent time to pump. We encourage the employer to prepare a plan to cover the employee when they are on their pumping break. And then typically an ideal space will include comfortable seating, electrical outlet, a small table, access to a small refrigerator, access to a sink. And as a team, the support that we provide include advising about this, sample policies to help them create that lactation policy, educational materials, and lactation room furniture and signage. Next slide, please. So this slide shows all of the work sites throughout the Tri-County area that have achieved the breastfeeding friendly certification. What that means is they have a policy in place and they share that with all of their employees. And they do provide that time and space for their employees to pump or nurse their baby on site. So these are the ones in Tri-County area, but to date, as a regional team, we have supported 107 work sites in achieving the breastfeeding friendly certification. And to help with sustainability of this project, we are partnering with Colorado Breastfeeding Coalition to get a statewide employer certification up and running by early 2023. Next slide. This is a list of the childcares that are breastfeeding friendly in the Tri-County area. And then again, as a regional team, we've certified 106 childcares in achieving that certification. Childcares have an additional step to achieve their certification that includes making sure their infant staff complete a breastfeeding and support training in childcare. So we want to make sure they complete that training. And then we have already been partnering with Healthy Child Care Colorado with their state certification program. And so they will continue to certify childcares once our grant sunsets in June of 2023. And then next slide. So medical offices have the most steps to achieve their breastfeeding friendly certification. And it's a 6-step process, which includes having a lactation policy, but also having all staff complete breastfeeding training hours. We want to make sure that they have patient education for breastfeeding. The environment step includes already being certified as a work site, meaning they already provide that support to their employees, but they also make sure there's no formula in sight and that kind of thing. So that covers the environment piece. And then for evaluation and sustainability, that part includes some billing and some breastfeeding rate and data collection. And then the continuity of care piece, it has referral systems and make sure that they do follow up with their breastfeeding families. So as a team right now, we are having conversations about where the medical office certification will continue after our grant ends next year. And then looking on this slide, you'll see that Every Child Pediatrics is in bold. They have achieved the medical office certification, and they have offices both in the Tri-County area and in the Jefferson County area. And then Stride is getting close. They still have a few more steps to complete, and they have offices also both in Tri-County and Jefferson County. Exciting news, Castle Rock Pediatrics just met all of their steps as of last week. And so we will be recognizing them as a breastfeeding friendly medical office. And I have an article that I'll put in the chat after my piece of this to share. It's an article that goes into more detail of all of the steps taken for them to complete that certification. And then Main Street Pediatrics is right behind them. They're pretty close too. So I'm hoping to have them certified as breastfeeding friendly by the end of this year. And then we can go on to the next slide. This just shows you some of the grant funding that we provide to sites to help them create a lactation space, whether it's using a privacy screen or, you know, if they have a small room, a chair, a table, signage, maybe a little mini refrigerator. So those have been popular items requested. And then if we move on to the next slide, this just shows you an example in all of the different sites. So you can see a lactation space in a work site, one in a childcare, and then one in a medical office. And the medical office is still a little bit of a work in progress. We're planning to get some more artwork on the wall and make it a little bit more homey as a lactation space. And then moving on to the next slide, for recognition, they get a window cling to display, a digital logo, printed materials, announcements through social media. They get a certificate and photos for promotion. And why this is important for employers, having this certification helps with employee recruitment and retention. And it also helps childcares in marketing themselves as breastfeeding friendly to families. Families will seek out childcares that they know are going to support their breastfeeding efforts. So we want to make sure they have all these materials to really promote themselves as breastfeeding friendly. And then going on to the next slide, to conclude my piece of this presentation, I just wanted to mention the laws that originated in 2008 to support nursing families in Colorado. The workplace law here in Colorado includes more families than the federal law by stating all employers must provide time and space to their employees, compared to the federal law that includes employers with 50 or more employees. And Colorado law, this also requires that the employer provide the support until the baby is 2 years old, whereas federal law requires it until the baby is 1 year old. The second law here listed is just a reminder that a breastfeeding parent may do so wherever they have the right to be. And the ABC grant really helps ensure employers are aware of this law and helps them work through the details so they can provide support to their employees. It also helps employees understand their rights and supports them in achieving their breastfeeding goals. So now I would like to introduce Greta Allen for the next portion of our presentation.
Thank you, Sue. Hi, everyone. I'm Greta Allen. I am one of 2 regional health connectors at Tri-County Health Department, and I'm really excited to share about this project work. It's been a highlight of my year. So just for an introduction, the Colorado Blueprint to End Hunger is a statewide initiative that began in 2019, and the goal of it was to create a roadmap for ending hunger in Colorado. The Blueprint functions as a coordinating and a capacity building entity for its many members. And so in October of 2021, Tri-County Health Department was awarded funding through the Blueprint's cross-program alignment work group. And this funding was a deliverable through the Blueprint's overarching work group 4, which has the overall goal of increasing Colorado WIC and SNAP enrollment percentages to be greater than or equal to the national average. So the Blueprint defines cross-program alignment as the enrollment of Medicaid members specifically into WIC and SNAP. But for this project at Tri-County, we did expand cross-program alignment to be enrollment into any program concurrently with another between those 3. And I also want to highlight that the objectives for this project aligned with not only our FIP focus area of health and food, but also access to care. Next slide, Jill. So the project purpose was to address barriers that prevent clients from seamlessly enrolling into more than one of the 3 programs, Medicaid, SNAP, or WIC, and to provide evidence of what could be possible solutions related to policy or administrative functions that create barriers for that cross-program alignment. Next slide, Jill. The 3 project objectives for this work were 1, to create a permanent workflow at all 3 programs' entry points, WIC, SNAP, and Health Enrollment Team, which you may see abbreviated as HET throughout this presentation. But to have that permanent workflow that asks about other program participation and facilitates co-enrollment. A second objective was to engage our WIC, SNAP, and Health Enrollment Team staff to map their clients' journeys through enrollment and then identify areas that are presenting barriers for the clients, the staff, or our county human services partners, recognizing that they're crucial in the pathway to getting enrolled in SNAP and Medicaid specifically. And then lastly, we wanted to identify potential solutions to present to the Blueprint to End Hunger and the state and regional and local stakeholders that sit within those work groups at the Blueprint, just to improve practices. Next slide. So our project team was established by identifying subject matter experts for each program, SNAP, WIC, and Health Enrollment. And I felt it was really important to have participation at not only the administrative level, but also the direct service level, and to make sure that the team was interdisciplinary. So as you can see, we had a really robust team of just some great leadership and our subject matter experts that are having that face-to-face time with clients. And once this team was established in November, everyone met to identify metrics and a timeline for this work. Next slide. So this is our timeline. It was created using the Plan, Do, Study, Act, or PDSA model. At first, this just looked like gathering information and mapping out the current state of how referrals are looking between programs, and then as well as discussing with the team what a desired state could look like. We met with county human services staff and some other Blueprint partners just to get a feel for what referrals are looking like at the local and regional level. Next, we developed and trained staff on piloted workflows, and I'll review that in the following slides, and also just thinking of ways that we can measure impact and success. Currently, where we are in this timeline is evaluating the changes made and identifying opportunities for sustainability in these referrals beyond this pilot project. And our last steps will be to report out on our findings to key partners in the Blueprint and make suggestions visible to stakeholders and demonstrate, what's positively impacting or negatively impacting the process of co-enrollment for clients. Next slide, Jill. The project team engaged in a planning event with the goal of mapping the 3 program workflows, so SNAP, Health Enrollment, and WIC. And the point of mapping those workflows was to identify potential pain points that possibly could be improved and reduce barriers. And so all of those action items that we came up with as a team were organized into an effort impact matrix, which is on this slide here, and placed into one of three categories: quick wins, which were considered low effort, but really high impact; worth the effort, which maybe would take a little more time, but still have a good impact. And then we also included reach goals that were considered really high effort, but really impactful. Next slide, Jill. So the action items on this slide were the ones identified as quick wins, and this included a crosswalk of documentation requirements across programs. And the purpose for that is that I think all staff of the three programs recognize that there are redundancies in what we're asking people applying to present, and just trying to see where are those similarities and where is it being redundant. And then the largest impact action items listed here was the trainings for program staff on how to improve referrals between each other, and also the creation of a referral guide for staff to reference. It's a digital guide. It's always being updated as needed, and it provides technical assistance with using our different Vonage and iPhone communication systems, how to do a three-way call, a warm transfer, how to recreate that warm handoff feeling with most of our staff being remote. And then it also includes scripts and helpful reminders of how to inform clients of other programs they may qualify for. I will note, there were other action items we identified, such as cross-training our health enrollment team staff into our WIC scheduling, and then also the possibility of shared verification of client documentation. And it was just determined that those action items would be unsustainable given all the changes happening between programs and just staff capacity. But what was helpful was that in our initial pursuits of those action items, we did glean a ton of information talking with CDPHE WIC leadership and some other partners that I hope can be helpful for future iterations of this project. Next slide. So in summary, what's left is that internally we're comparing the number of referrals between the programs for May through September of 2021 to 22, and seeing if there were any changes or increases in referrals from SNAP to WIC or WIC to health enrollment between last year and this year. Hopefully we see an increase, also recognizing that there are many factors that play into why a client enrolls in a program, and definitely recognizing that during COVID, which is still occurring, but there's been shifts in employment and whether or not someone would be able to be eligible for these programs. In addition to our own looking at data, the Anschutz School of Medicine is the evaluation partner that was hired on by the Blueprint for this project, and they are conducting client surveys and interviews of our staff and clients to see their experience before the project and after. And those results will be available later this year. And lastly, I just want to highlight several factors that go into a successful cross-program alignment or also a co-enrollment model. And the three key influences that this project demonstrated were that, one, shared data and shared scope of work are really important. Our programs were limited in what they can share with staff from another program, and this is partially responsible for the redundancies clients experience when enrolling across programs. Secondly, shared funding streams can allow for cross-training and easier program enrollment. We already see that with our incredible SNAP application assisters that are embedded in our WIC program. And so we didn't pursue this as much as I would have liked to. And that was, again, just due to staff capacity and where Tri-County programs are needing to be at the end of this year in terms of wrapping up and transitioning. But I hope, again, that the results of this work can go into future practices and maybe hopefully attempts at this. And then the third influence is that state level support from the Colorado Department of Human Services, the Healthcare Policy and Financing Department, and Colorado Department of Public Health and Environment are crucial to be able to create a cross-program alignment structure. I'm grateful to the Blueprint because it brought these entities into this conversation. And so we are hoping that this project work can bring attention to maybe some potential policy changes at the state level to help these programs better align. And lastly, building trust between staff and clients is incredibly important for increasing and maintaining enrollment. And I think that if we can demonstrate through this cross-program alignment that you can save time, result in clients receiving benefits, they have a better experience, and ultimately that can increase the amount of clients enrolled and support more innovative partnerships and maybe more things like this to get more folks connected to resources that they need. And lastly, I will say, I think that with the creation of single county health departments and the connection that we already have, but will continue to grow with those individual human services departments at each county, can really be crucial in helping this work continue. And I will pass it on to Caitlin Matthews.
Thanks, Greta. All right. Well, my name is Caitlin Matthews, and I'm the Food Systems Coordinator here at Tri-County. I lead the Food and Communities Grant Initiative, and I'm going to highlight some of our accomplishments from recent years. But first, maybe you haven't heard of Food and Communities. So Food and Communities is a 5-year collaborative with our fellow health departments in Denver and Jefferson County. Through Food and Communities, or FIC, the 3 health departments work to increase access to healthy, affordable, and culturally important foods. And we do this through 4 main strategies: partnering and engaging with community members and organizations to identify assets and needs, collaborating with the community to design and implement food access, food justice, and food business opportunities, supporting local food policy councils and community coalitions, and leveraging funding for community-led projects. Next slide, Jill. At Tri-County, Food and Communities is housed in the Land Use and Built Environment team in the EH division. And we have an overarching focus on policy, systems, and environment change, as well as a geographic focus in Adams County, and specifically in 2 areas, Northwest Aurora and Southwest Adams County. There are 3 main threads of our work at Tri-County: the local land use planning and policy, state and federal food and agricultural policy, and community partnerships. Next slide, please. So for land use planning and policy, we provide technical assistance to the city and county governments in our jurisdiction. And we do this through land use case review, subject matter expertise, data analysis, and mapping. We review and provide public health recommendations related to the comprehensive plans, sustainability plans, unified development codes, zoning code updates, etc. And all of these greatly influence the food environment. So a few examples of our recent work is that we provided recommendations for the Littleton zoning code updates to ensure that community gardens, farm stands, farmers markets, and mobile vending are permitted uses in as many zones as possible. And we saw those recommendations result in multiple changes to the zoning code. We served on the technical advisory group for the Commerce City Comprehensive Plan, where one of the primary issues of interest is food access. We also participated in the community advisory team for the Westminster Transportation Master Plan, and as well as provided feedback and recommendations on the Westminster Comprehensive Plan and zoning code updates. And then as recently as this summer, we reviewed the Advancing Adams Comprehensive Plan, specifically focusing on opportunities to integrate strategies for food access and opportunities to expand food retail. In addition to the technical assistance, we've also been working to build capacity of local government staff. So particularly those in planning departments, but as well sometimes parks and open space, libraries, community services, community economic development, so that they really build their capacity internally to think about food systems and some of those planning and processes that happen regularly in the counties, because we know planners are so often asked to be generalists that they don't have a lot of expertise in food systems. So we engaged a national leader in local food policy and hosted the municipal food policy training in 2021, and also offered food policy consulting sessions in 2021 and 2022. And we had local government staff or teams from Adams County, and then also 7 city governments in Adams and Arapahoe counties. Next slide. So a significant portion of our time working on food systems is really spent engaged in community partnerships. And we partner very closely with community-based organizations that have trusted relationships with community members. So this is really where kind of the rubber meets the road, and we practice those community engagement, equity practices that our health department wants to embody more on a day-to-day basis. Tri-County staff serve as conveners, facilitators, and connectors in community partnerships. For the past 3 years, for example, I've been convening a coalition of nonprofit organizations, faith groups, public institutions, and resident leaders focused on food and agriculture issues in Northwest Aurora. And I also work in deep partnerships with Southwest Adams County partners who engage in community organizing to address food access issues. Each year, the Food and Communities team and the Land Use and Built Environment team provides technical assistance to over 20 partner organizations, mainly through subject matter research, data analysis, mapping, and strategic thought partnership. And then we've also leveraged funding for partners to implement projects, programs, and strategies in the food system. We've helped write grants, we've written letters of support, and importantly, we've helped bridge relationships between funders and the partner organizations. So to date, our team has helped secure over $920,000 from 11 public and private sources, and all of those funds went directly to our community partners to implement work. Next slide, please. So as part of Tri-County's broader policy work, the land use team participates in multiple statewide policy work groups focused on food and ag. And then we bring those policy opportunities back to the agency. Policy engagements are anywhere from sign-on letters and letters of support to public comments and written and oral testimony, either in the legislature or during the rulemaking processes once a bill passes. So some recent examples over the past few years of our policy engagements include public comment in 2019 for the Supplemental Nutrition Assistance Program rulemaking on standard utility allowance, which is part of how benefits are calculated. At the state level, we've also supported in 2021 and 2022 the bills for the Colorado Food Pantry Assistance Grant. And in 2021, we also testified during the rulemaking processes for the Agricultural Workers' Rights Bill. Next slide, please. So when Tri-County dissolves at the end of this year, the food systems work in our jurisdiction will take some new forms. We know that Adams County Health Department has created a food systems position and is investing general funds to staff that out and really help serve across the county in relation to food systems. And then Food and Communities itself, with the grant that goes through next June, will be carried forward by 2 of our community-based partners, Growing Home in Westminster and Food Justice Northwest Aurora in Aurora. And then I think, as Jennifer Ludwig commented earlier, this maybe is one of the areas that Arapahoe County would be seeking additional funding to build out positions in the future. So with that, I'll pass it back to Jill.
Thank you, Sue, Greta, and Caitlin. So just to wrap up, the graphic to the right, you might recognize from last September. It's kind of the food systems and how the Tri-County Health Department FIP and programming really fits into it. And our niche is really around consumption and access with that. But the other big piece is that almost 100% of the work that we do around health and food is funded through grants, which can have limitations. I mean, you could be very have innovation within our grants, but then if there are new things that arise, sometimes if it's not within the scope of work, it might be hard to pivot to some of those things. So as we look forward into the new health departments, it will be really important to continue to seek different grant funding, but also other funding that might give you flexibilities and being able to lean into different things that might be recognized through the community health assessments and some community engagement. But I do think, I I think there's a lot of momentum and great partnerships that have been formed across our jurisdictions. We want to continue to leverage those partnerships and continue to move the work forward, and definitely engage our community in those decision-making processes and how we focus our areas around health and food, because there's so many aspects and pieces of the system that we could work within. So with that, we'll close for questions, but I did want to plug our Healthy Farmers Market that is up in Adams County. There was a write-up in the Board of Health Executive Director's report that gives a little bit more information. We'll be running through the end of September. And within the write-up, there was also information about our CSA produce boxes and the community gardens that are occurring up in Adams County, but I had to plug that too, as they were part of the plan. So I'm going to stop sharing as I see there's some chats and open it up for any questions you guys might have.
Thank you. Thank you, Jill, Greta, Sue, and Caitlin. So it's really gratifying to see the really strong foundation that your team has created around food, particularly since it's become such an increasingly challenging issue throughout our region. So great work. Do I have any questions or comments from the other Board of Health members? I thank you for ending your conversation with this as a foundation that you're moving towards the new health departments that are emerging. And I guess I have one question. Since some of the grants are 5-year efforts, the ABC grant looks like it's going to continue through next year. Is there going to be a way for the new health departments to kind of slip in and be Tri-County in these partnerships?
I believe with it, I mean, the new counties will need to apply for some of these new funding sources if it wasn't transferred over. And maybe Jennifer might be able to answer some of those questions better, or even with Caitlin's, where some of the work is being transferred to community partners, not that they won't be working with the individual health departments. So the great work will continue, but I think it will have to, once the counties get established, is applying for those new funding sources to expand or enhance efforts already taking place.
Jennifer, did you have a comment?
I'll just add that, some of these funding sources are competitive. Some we've been working to try to, can the contract or agreement transfer in January? Heather, and this is separate work, but we have been looking at where does it might make sense for a community partner to take over this work to ensure that there's no gap or that it continues for sustainability. So all things are being considered, but especially things that are competitive or that we're waiting to hear from the funder. But we are absolutely looking at all things that we currently do, especially really, really critical, important work like this. How do we make it? How do we ensure that it continues? Whether it's with us as the new health departments or in the community, but let's not lose ground.
And I'll just say for the ABC grant, it's a little unique in that Colorado Health Institute is our grant manager. So as of January, I'll be learning how to be a subcontractor and subcontracting with them, at least to see through the grant through the end of June. So because I love this work and I'm happy we were able to work something out.
Good to hear. Thank you. Thank you for this wonderful presentation. Not seeing any more questions or comments at this point. Lots of appreciation in the chat. Please check that out. As our next item, Dr. Douglas, can you provide us with an update on where things stand with the COVID-19 epidemic and monkeypox?
Sure. As I phase into this and as Lisa pulls up the slides, I want to also thank the nutrition team. I just think what you heard from Jill and Sue and Greta and Caitlin has just been such fantastic work. I think we're all incredibly pleased and excited about the possibility of this transitioning to the new health departments. But I also want to talk about that, or just congratulate them on that angle. When a public health department gets a grant, very often, as Caitlin talked about, it results in collateral benefit to community. And so $1 million in leveraged funding is just tremendous. And to see some of these grants also be able to transfer to community organizations. I mean, the team works for Tri-County. They've done a fantastic job. We have been doing things other than COVID. But, they don't own it. The community owns it. And I just think that's sort of public health at its finest. And I want to thank all of them for their, this has been a tough year, and to keep their excitement and momentum and obviously great work going at this point. I'm just it's incredibly rewarding to see. So thank you guys very much. So, well, on to COVID and monkeypox. Next slide, please, Lisa. I'm going to talk briefly, and I will be brief, about COVID trends and then an update on monkeypox. Next slide, please, Lisa. I want to begin with the variant story, and the variant story is pretty interesting. That light blue color in these serial histograms of BA.5 Omicron shows that BA.5 is still, number one, the predominant variant that we're experiencing, probably about 85% or so. There's been a little creep in of that maroon colored variant, BA 4.6, but it hadn't gone very fast. And the time that BA.5 has been with us is getting close to being longer than any Omicron variant since the very first one. And there's been sort of chatter about what does that mean? Is this the top of the food chain in terms of transmissibility? And is BA.5 going to be here for a while longer? If so, that would be a good thing, both because having new variants emerge has created new waves of disease, but it's also a particularly good thing because I think, as you're probably mostly aware, the newly authorized and now delivered to clinics across the country bivalent booster vaccine has got the original Omicron strain as well as BA.5 in it. So the people who sort of guesstimated what we'd be dealing with in the fall, at least so far as of September 8th, appear to have guesstimated pretty well. It does appear that BA.5 is really what we are facing in the community. Next slide, please. The next several show us Tri-County on the left and the state on the right, trends in cases by age groups and hospitalization. So this is overall cases. Caveat number one, as we've been saying now really since about last February, we know these are dramatic underestimates. So we think the shape of the curve, it's going down, it's staying flat, whoops, it's going back up again, is probably reality. But we think the height of the curve, look how much lower we were in June, for example, or early July than in January. That's probably not reality. That's probably surveillance systems not capturing where most of the testing is at, which is in rapid antigen test. So we appear right now to be in a fairly promising plateau phase. We're not as low as we've ever been, but we're pretty low. The modeling data suggests that we're probably going to be in this phase through mid-October or so. The modelers have learned their lesson that their crystal balls are only good for so long. I mean, they never knew they were or felt they were good forever, but they're only making predictions about 6 to 8 weeks out. But at least the 6 to 8 week out prediction looks pretty favorable. That's good, by the way, for our all staff meeting, where we're hoping to gather together in about 2 weeks. It should be at the perfect time when boosters are out and rates are about as low as they've been. Colorado's currently got the 10th lowest case rate in the country, so we're in relatively good position. Next slide, please. These are data that we're following with some interest as schools are now back in session for about the 4th week. And these are data on the left in the Tri-County area and on the right in the state area. Looking particularly in the state data, it's a little more clear that we're beginning to see an uptick, particularly in 5 to 11-year-olds and 12 to 17-year-olds. Now, we're not yet seeing that so far in Tri-County. And I discussed this with the data team a few days ago. I think it's probably got to do with lagging data that we're getting. The state's getting data a little faster because I don't think the 25% of the state's population that we're following is probably behaving all that differently than what's happening statewide. Late this afternoon, we got an updated age-based slide, and those trends in 12 to 17 and 5 to 11-year-olds are getting steeper. So I think there's little question that being back in school and resuming various activities is probably resulting in more transmission of infection. This is, of course, in an era where we now have plenty of vaccines for all the kids, certainly not a reason to be alarmed in a major way, but our school team is working really hard with the school systems to help them understand how to handle COVID in a time period where the special treatment that was being given in schools 2 years ago is no longer being carried out. It's really being carried out and monitored and responded to like other infectious diseases, including flu and norovirus, for example. Next slide, please. These show test positivity trends, which when we are, if you will, under ascertaining cases, probably is a good triangulation of reality. And I'm quite comforted by the fact that the test positivity rate, which is around 6, 7, 8%, both in our counties as well as the state, that confirms that the relatively low number of cases that we're seeing now probably is a measure of reality. Next slide, please. You know, of course, we remain primarily interested in the fact that COVID makes people really sick and in some cases die. And we are, by the way, still experiencing somewhere around 400 deaths a year nationally. It's kind of a number we've got numb to. These aren't deaths, these are hospitalizations. The hospitalization story looks quite favorable in Colorado. I mean, we're still seeing hundreds of people hospitalized, but they're much lower than they have been. We're actually at about the lowest point we've been in the pandemic. And currently Colorado, in a rate per 100,000 population, has the lowest rate of any state in the country. Now, I don't expect us to stay that way because we are, you know, healthy living people in Colorado and that kind of thing, because these things do vary. But it's another sign that we're in a pretty good point at this time in terms of the severe outcomes of COVID. Next slide, please. I keep showing you these CDC maps, and I'm giving you another one in the serial series to let you kind of see how things have evolved. These are CDC community levels. They include and combine metrics of both case rates as well as hospitalization rates. And CDC uses them to administer advice, particularly about when masking in public indoor spaces or avoidance of public indoor spaces for particularly at-risk people should be considered. And as you can see, starting upper left, April, Colorado was almost all green. We get into June, we are seeing more yellow and orange. Yellow and orange are higher levels of community transmission. By our Board of Health meeting a month ago, still mostly green in Colorado, but like the rest of the country, we were experiencing a number of areas of moderate or even high level of community transmission. What's interesting is that as of a week ago, I didn't get a chance to update this. Colorado was actually looking substantially improved at a statewide level. We only had 2 counties that were anything above a low level of transmission. That shifted a little bit on the data I saw this afternoon. But interestingly, this Mountain West region, Nevada, Utah, Colorado, are all looking fairly favorable, at least at this point in terms of CDC measured community levels. Next slide, please. Turning to vaccinations, you know, this is a good news, bad news story. I mean, the good news is the overall vaccination rate continues to inch up. The completed vaccination rate, for example, in Adams County, 67%, Arapahoe County, 69%. Booster rates above 50%. That's good news. But the bad news is vaccines continue to tail off. I don't know whether we're going to see those go up again with a new booster that's now got a double-barreled set of protection in it. The bad news is also that we are seeing far lower than what we would think to be adequate rates of folks receiving boosters. And when we measure booster uptake rate, we're only measuring in people who've taken the original series. These are people that already felt like, oh, okay, I'll take the vaccine. We're also, if you look at the right-hand graph, still seeing lower than optimal rates of vaccination in our younger age groups. And while kids do not get very sick with COVID, they do get sicker than they do with influenza, and they do get protected by the vaccines. A study just published in the New England Journal this week out of North Carolina showed a fairly marked low levels for both vaccinated and unvaccinated kids, but a marked reduction in the number of deaths in children among those who were vaccinated versus those who were not. So we're quite interested in seeing these groups go up. And although I'm not showing you a slide on the rates by race ethnicity, we are continuing to struggle with that. with particularly our Hispanic community members having lower rates, which is, by the way, what we're seeing now with monkeypox as well. Next slide, please. These are data the state analyzes and provides to us every week or so to help us understand how much value you have in terms of preventing severe outcomes if you receive a booster, in terms of hospitalization or in terms of death. And the protective edge remains fairly substantial, 3 times the greater degree of protection against getting hospitalized if you've been boosted, 4.5 times protection against death if you've been boosted. And I'll remind you, even though we're just forgetting about the fact that COVID is still killing around 1,000 people every 2 weeks, there's still plenty of mortality happening. Vaccines remain, especially when we have new ones, as important as ever. Next slide, please. I want to thank the team who has been working really diligently in the community. We are continuing to focus on getting vaccines to particularly the younger members of our community, as well as those that are older. We're quite excited about the Omicron specific booster. This slide says it's coming in the fall. And Lisa, I'm realizing this is last month's slide. I wonder if this didn't get deleted. Can you go to the next slide? I felt like I was Groundhog Day. I think we got the wrong presentation. Let me just say that the team is working quite hard with our school systems, with our community events and community organizers to try to get as many community-based events as possible. One of the big problems we're facing is that, I think you're probably aware, Congress has stalled on responding with increased appropriations for vaccines, treatment, and testing. You may be aware that federally provide free at-home antigen test ended about a week ago. We're seeing less support for community events. CDPHE has been able to keep its vaccine buses going, which help us get access in underserved communities. They also announced a couple of days ago, the governor just got a vaccine himself at one of 10 mass vaccination sites around the state. One is going to be in Waterworld, and another one's going to be at Dick's Sporting Goods. So we're happy to see those come in, although we're concerned that we're losing the capacity to reach as many folks through community-based events as we had been able to experience previously. This slide was introduced or put up a little prematurely, but it was sort of an exclamation point on data that was released by the National Center for Health Statistics about 7 to 8 days ago, looking at life expectancy in the US, and it's sort of an exclamation point for what we've been living through. And average life expectancy of Americans in 20 and 21 sustained the sharpest 2-year decline in almost 100 years. And the right-hand graph shows you that while this was spread across all groups, a reduction from 78.8 in 2019 down to 76.1, that's a 2.5-year reduction. It was greatest in some of our communities of color, particularly greatest in our Native communities, where the reduction was over 6 years in life expectancy. And while we have certainly seen contributions from other causes, such as the drug overdose epidemic, there's no question that the pandemic was the major driver of that. Again, putting an exclamation point for the incredibly challenging times that we've been living through. Next slide, please. Shifting, I think, now to monkeypox. Yeah, we got the right slides now. Interesting story. We're beginning to see a flattening, or in some cases, maybe even a possible decline in monkeypox cases. The left graph is looking at data from WHO. These are data, again, it's about a week old now. And that seeming flattening has continued now. I'm not sure it's fair to call it a distinct decline, but we aren't certainly not seeing the sort of spread that we were seeing earlier. The estimate now in the US, for example, which is shown on the right side, is that the doubling time for new cases, which was about 8 days in July, has gone up to about 25 days in August. So really confirming that while we're still seeing plenty of new cases, the trend is beginning to flatten out and even potentially begin to appear to show some decline. Next slide, please. We're seeing a similar sort of pattern in Colorado. I think our data are a little harder to look at because we show data with a gray zone of data in the right part of the graph, but more recent data that I saw this morning showed that we were seeing the same sort of improvement. We're continuing by virtue of the fact that the vaccine can be divided into 4 or 5 doses each, able to reach more people than we were before. I want to thank again our immunization team as they are, trying to figure out how to get back to school vaccines in, as they're gearing up for influenza vaccination. They've really done a fantastic job of stepping up for vaccination at various monkeypox specific clinics. Next slide, please. In terms of why we're seeing the reduction, interesting data that came out of the CDC, 2 articles in the MMWR last week. I think the most important is the data on the right side of the slide, that in a large sample of gay men who responded to an internet survey about sexual behavior, there were reductions of sexual behaviors of a variety of types. Number of sex partners down 48%, one-time sexual encounters down 50%, sex partners met on a dating app or a sex venue down 50%. These are measures that the gay community or men who are having sex with men who are not part of the gay community necessarily, or not necessarily gay identified, are taking. And this is almost certainly a major contributor to the trends that we're seeing. Part of the reason I say that is the modeling study on the left side that CDC published in the same MMWR edition suggested that men with more than one sex partner in the prior week had a 2 to 7 times risk of monkeypox compared to those with only one sex partner. And while one sex partner or one-time sexual partnerships comprised less than 3% of all partnerships, they accounted for 50% of monkeypox transmissions, and that a 40% decrease in one-time sexual partners could reduce the number of infected people by 20 to 30% and delay outbreak spread, allowing more time for vaccination. So at the same time these modeling data were pulled together and published, we saw empiric data that in large communities of gay men across the country, we're beginning to see those behavioral reductions, which is, I think, incredibly complementary to the vaccination work. Next slide, please. Again, I want to thank the team for responding both with very effective vaccination work, with work in developing our capacity to supplement CDPHE efforts in case investigation and contact tracing. Very appreciative of the work the nursing division has been doing, particularly with Adams County Health Department. Kelly is exploring hiring several new staff to help us set up diagnostic capabilities in one of our clinics, that the Northglenn Clinic, which is in Adams County. I think it's a great bridge to giving their health department a jump into having capacity to deal with monkeypox going forward. At this point, we're not exploring treatment, although that remains in the background. About 35 to 40% of Colorado cases are requiring treatment. We, of course, are still facing transition challenges, and that's, I think, slowed up some of our nimbleness of response. But we do think that working in all of the above areas will not only help slow the epidemic now, but also create greater capacity across the metro area. We took part in an effort last week to communicate a potential emergency request to the legislature for monkeypox funding. And we've gotten preliminary indication that there may be some initial emergency funding available to help us, and maybe to help us with the Adams County diagnostic assessment effort as well. I will note on the right part of the slide that the state has changed criteria for those who qualify for vaccination. The criteria have been expanded. It's no longer linked to sexual orientation and gender. It does include those who've had multiple sexual partners or anonymous partners, or folks with contact in a place where anonymous or group sex may have been happening in the past 2 weeks. It also includes, however, folks who've had an STD diagnosed recently, those that are using HIV PrEP medication, or those that have engaged in commercial or transactional sex. Since all of these have been shown to be risk factors in a growing epidemiologic studies that have been coming out about monkeypox in the US. Next slide, please. And that's the last one. So overall, COVID will be with us through the duration of Tri-County. That one we can stop, Lisa. That was a leftover from last time, and we can stop the slides because you're going through old ones now. And I am cautiously optimistic that monkeypox will be a controllable challenge, even though it's one that we're still seeing certainly lots of infections. So happy to take questions on either topic.
Thank you. Any questions? I'm just curious. I know the state health department had provided funding regarding HIV prevention to many community-based organizations, and I'm just wondering if some of their monkeypox prevention efforts are using that network of the HIV prevention community.
There's a lot of effort to do that, Kaya. One Colorado, which used to be the Colorado AIDS Prevention Project, has been really active in linking community groups for a number of things, giving advice about best venues to try to reach people, giving advice about messaging. I mean, I think they're probably being careful with their funding streams. We're trying to get permission to use COVID funding to help us with some of the monkeypox efforts. We want to be careful that we don't spend out of alignment. But I do think your larger point is that infrastructure, particularly in HIV prevention, has created a greater degree of community engagement with folks that are involved in this effort. Now, having said that, we are clearly seeing, as I've already mentioned, lagging vaccination in our communities of color. Rates of vaccination, while we don't have great denominators for what part of any ethnic group is likely to be in one of the risk categories, when we look at the number of cases occurring by race, ethnicity, and we look at the proportion of people vaccinated, we're clearly having the same problem again. So I think that lesson, or rather those relationships have been helpful, but they don't fix everything, particularly with our communities of color.
Great, thank you. Any other questions, comments? Not seeing any. So let's move to the executive director's report. Thank you, as always, for that very thorough summary of activities. I was particularly pleased to see the detailed information regarding communicable diseases that are still circulating in our areas. So thank you for that information. Did you have any comments about that?
Well, I want to thank Melissa Adair for really doing a great job on giving us a very detailed CD report. Flu season is here. We really are trying to promote COVID vaccination along with flu vaccinations. The other one that I would highlight, I think you probably heard it in the news, is the polio story. And this is like polio, really? You got to be kidding. And this is only one paralytic case so far in New York and the greater area, but they are detecting vaccine strains of polio in the sewage. These counties in New York in which this is occurring are particularly lowly vaccinated counties with vaccination rates of only about 70% or so. In Colorado, we range, varies year to year, but it's about 88 to 89% for kindergartners and about 93% for high schoolers. That's really good. It's probably enough to keep disease from spreading here, but these are wake-up calls that old diseases that still have not been eradicated can remain an issue. So we want to be very vigilant. The last thing I would say is the weather's still hot. The mosquitoes are still swarming. Let me remind all of you, be cautious at dawn and dusk when mosquitoes bite. And we have had 3 deaths in Colorado this year, one in one of our residents. So a very real thing, even if we're COVID vaccinated.
Thank you. Okay, let's move on to other items. So based on our early discussion, the Board of Health has decided to skip the October board meeting, but as we plan for our November meeting, be sure to let Julie Maleka or myself know if there are topics that you would like to make sure we cover. And that's then the next item is board member remarks, closing remarks. Does anybody have anything they'd like to say? No, not seeing that. As always, I'd like to thank my fellow board members, and particularly Julie Shells, who joined us from the Austin Airport. for volunteering their time in service of our citizens. And my special thanks to the Tri-County team, particularly all of the members of Jill's nutrition group who made a terrific presentation, and Jennifer above and beyond, to be wearing two hats at this point. So thanks to you. All right. As a final topic, we'll be moving into executive session to meet with our legal counsel in accordance with the Colorado open meeting laws. I say, Randy, you're with us. Did you want to cite the provision that allows for client attorney consultation with the Board of Health and list the topics we'll be reviewing?
We're going to move into executive session under CRS section 24-6-402, subsection 4, subsection B, to discuss the status of 3 court cases involving the department and legal strategy concerning those cases, and time permitting, may discuss legal issues concerning negotiations of termination, assignment of various leases.
Great, thanks. Do I have a motion to move into executive session for consultation with our legal counsel?
Moved.
Second.
Thank you. All in favor, say aye.
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 Anyone opposed? Okay, we will now move into executive session. Lisa, can you transition us?
Yes, at this time, I'd ask that anyone who is not on the Board of Health, Dr. Douglas, Jennifer, Bellanne, or our legal counsel to please leave the meeting, and then I'll lock it down.
Okay.